welcome Dr. Siva, an expert on varicose veins and venous disease of the legs in the Tampa Bay area, who is going to educate us on that topic. Welcome, Dr. Siva.
Thank you.
Doctor, what is venous insufficiency?
Venous insufficiency is a problem with the flow of blood from the veins in the leg back to the heart. It is also called chronic venous insufficiency or chronic venous stasis.
What causes venous disease?
The veins in the legs have valves that keep blood flowing in one direction, towards the heart. In venous disease, the veins in the legs are dilated and therefore the valves don't close well like they should. And that causes pooling of the blood in the legs and leg edema and multiple problems like varicose veins.
Doctor, how common is venous disease?
Actually, venous disease is much more common than you think. This is seen in 40% of females and 17% of males. Varicose veins is actually more common and is seen in 73% of females and 56% of males.
Who can get venous insufficiency?
Anyone can get venous insufficiency. It's more common in older people, people who are overweight, smokers, multiple pregnancies, and people who are in occupations that require standing for a long time and who have a strong family history of varicose veins or venous disease. Lack of physical exercise also puts them at a higher risk of developing venous insufficiency. And people who've had deep vein thrombosis or clots in their legs are also at a higher risk of developing venous insufficiency.
Doctor, how do I know if I have venous insufficiency?
The typical symptoms of venous insufficiency may involve swelling in the legs, particularly the ankles, heaviness or tiredness in the legs, pain in the legs, cramping in the legs at night, restless legs, varicose veins, change in the skin color, sores or ulcers in the legs. Often patients ignore their symptoms for a considerable time.
How do you diagnose venous insufficiency?
Venous insufficiency is diagnosed by a simple ultrasound that is done in the doctor's office. This is not the ultrasound that is done to look for clots in the legs. This is a special ultrasound that is only done in the specialist's office. It takes about an hour and evaluates the size of the superficial veins and also assesses the degree of backflow or incompetence.
Doctor, if I have chronic venous insufficiency, how can you help me?
In addition to avoiding prolonged standing and modifying risk factors, I recommend compression stockings to my patients with venous disease. These are special stockings that are designed to apply specific pressure to the legs to help compress the veins and take the blood back to the heart.
Do you have to wear the stockings all the time?
Frankly, patients look at me very surprised when I recommend compression stockings. These can be hard to wear in warmer climates like Florida. And if you're wearing shorts, they may not look good on you. And some of the elderly patients may have difficulty in putting them on. But I tell them the recommendation is to wear them for at least 3 months to see if they help.
Doctor, can all patients be treated in this manner?
No, some patients may need a procedure called venous ablation. Patients who do not respond to compression stockings or patients who've had a history of past ulcers or have recent ulcers are candidates. What this procedure involves is passing a catheter through the superficial veins and closing these veins using laser or radiofrequency. In the past, these veins were removed surgically and this procedure was called venous stripping.
Closing the veins, isn't that dangerous? If the veins are closed, how does the blood flow from the legs back to the heart?
A lot of patients ask me this question. We only close the problem veins, which is the superficial veins. The deep veins are not closed, and these veins take the blood back to the heart.
Do I have to go to the hospital for this?
No, this procedure is done in the office and takes about an hour. Patients frequently drive to the procedure and drive back home after the procedure. There is no recovery needed after, and there are no restrictions.
Doctor, is this painful?
Not really. The ablation procedure is performed with a local anesthetic, and most patients tolerate it well.
Does insurance cover this?
Insurance covers treatment for patients who have symptoms but not for pure cosmetic reasons. Most insurances require pre-authorization. Insurance companies require that patients first try compression stockings at least for 3 months. And that is why I tell patients to try compression stockings at least for 3 months, even though they don't like to hear this.
Now let's move on to some actual patients who will talk about their chronic venous insufficiency.
I'd had leg cramps for months. I couldn't seem to find a medication that would help. A friend sent me to Dr.Siva. He closed my leaky veins that were causing trouble, and I have no more leg cramps. It's wonderful.
I had swelling in my legs and my ankles. I was put on water pills, which affected my kidneys. I wore support stockings for 3 months, and then Dr. Siva did venous ablation on both legs. I no longer have swelling in my legs and my ankles.
I had pain and bleeding in my legs, swelling from varicose veins, and I come to Dr. Siva, and he diagnosed me with venous disease. He closed the veins in my legs, and after that procedure, I was able to return to a normal life. Before that, I couldn't walk, I couldn't ride my bike with my wife, and I would highly recommend him for this procedure. It has changed everything about my life with my wife and myself, and I just appreciate him for that.
I visited Dr. Siva because I had an ulcer oozing fluid from my leg for months. Dr. Siva said I had a venous disease. After a simple procedure in the office, my ulcer has healed. Dr. Siva saved my leg.
I had restless leg syndrome and had heaviness in my legs. Dr. Siva told me this was from venous disease. He closed my veins with a venous ablation. I don't have restless leg syndrome or heaviness anymore.
I had tiredness and achiness in my legs for years. My symptoms were ignored. Dr. Siva closed my veins and my legs are not tired or achy anymore. I am grateful for Dr. Siva.
My leg cramps and my restless legs are much better because of Dr. Siva. He's the best.
If you have pain, cramps, or swelling in your legs like I did, you need to see Dr. Siva.
So there we have it. If you have venous disease or concerns regarding leg symptoms, please call the number on your screen to make an appointment.